From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Jack Kelly, Interim Chairman for the Department of Emergency Medicine at Einstein Healthcare Network. This is the ER Show. No one wants to have to go to the ER, but it happens to all of us sometime in our life. Today, we will learn how a patient can prepare for a visit to the ER long before it's necessary. Dr. Kelly, so let's get started with this topic. So can you share some protocols with us as far as an ER visit?
Well, you're right. Most of us wind up in the ER when we really haven't planned it out.
Sure.
And many times it's for something very serious. So this is a really important topic for us to talk about and for us to try to make some plans about. One of the main things is your medical history. You know, exactly what medical problems have you developed through your life? Could you create a list? And then also, could you attach a medications list that is able to be quickly pulled up, that has your medical problems and your meds and your allergies, maybe some surgeries you may have had in your life, things like that, and some emergency contact numbers, your doctor's name, your surgeon's name. So in case we needed to make a quick phone call to get more insight, we'd have all of this right in front of us. Now that everyone carries smartphones, you know, what a great idea to put it in your notes section.
Excellent,
and
yes.
To update it every month or two.
Yeah.
We really appreciate this because when we're trying to help you, we need to have as much information about you as possible.
Definitely. So what is your advice for patients out there who need to get to a hospital? They have an emergency. They either need to get a ride, they may need to drive themselves, or call an ambulance. What should they do?
It depends on their emergency. It depends on the life threat. If they clearly are having a life threat, and a life threat would be trouble breathing, trouble with thinking or consciousness, stroke-like symptoms where you're weak on one side, bleeding or hemorrhaging, seizures, you know, all these things are 911 calls where you have the medics come to you because they can render emergency care and then scoop and run. If it really is something, you know, where you could just be put into a car and driven fast, I guess that's okay, but you always worry whether or not you could deteriorate en route in the car. Yeah. So it's a tough decision to make, but I think if you're having major emergency signs or symptoms, calling the medics would be key. If it's something simple like a sprained ankle or a simple laceration that you could do the basic first aid on, you know, if you have a sprained ankle, it's ice, maybe some pain medicines like Motrin or Tylenol,
right.
Elevation. If it's something like a cut, it would just be direct pressure, and then you could get into the car and come over, and we'd look at the wound and decide whether we have to sew it up for you or not. And you certainly don't need a medic for that.
No. So can one be prepared for the ER? And if so, what are some steps that you can give them?
Well, be prepared to realize that you won't be the only patient we're taking care of. In a busy ER, there could be patients who are literally in the midst of dying, yes. or we're trying to save them. And I know that your emergency may be very, very concerning to you, right. But once you realize all that we're managing all at the same time, you may have to reshuffle how serious your concern is compared to everyone else's. It's almost like asking your neighbor about your trouble and then realizing their trouble is about 16 times worse than yours. And that's what happens in the ER too.
Definitely. So let's just say someone has to call 911 to summon an ambulance. What should they tell the operator, the dispatch operator?
Well, I think they need to be very concrete.
Okay.
Okay, operator, I have an emergency here, and then you describe what the scenario is. The operators they're very well educated on prioritizing the medic's response. You know, whether it be a paramedic unit or just an EMT,
right.
or just a firefighter unit that comes. Mm-hmm. So be as specific as you can. You know, My family member's unconscious on the ground. My family member stopped breathing. To be honest with you, the 911 operators actually have sort of prompts in their emergency screen that helps them try to ask the caller the right questions, so they're able to triage right there on the phone and bring the assets necessary to save a life.
Dr. Kelly, thank you so much for your time and this great information on this topic.
Happy to help.
Be sure to watch more episodes on this topic and other issues of interest to all patients here on the ER Show. We will see you next time.